So we know, for instance, that women who have a pre-existing mental illness are at increased risk, and so these risk factors are easily identifiable and can be mitigated. And every healthcare professional that comes in contact with such women has a role in helping women to make them aware of the risk factors and then signpost them to the correct services. However, many women do not have a previous history of a mental illness, and they develop a mental illness in pregnancy on the post-delivery period ex novo. So for these women, it's a bit more difficult to identify the risk factors. However, we have to also take into consideration a number of factors which are a bit outside the remit of psychiatry. For instance, many women find the experience of motherhood quite isolating. Many women also can face bullying and harassment in the workplace once they disclose the pregnancy or they take maternity leave. Many women, for instance, cannot access their normal coping strategies, such as exercising or socializing or engaging in leisure activities when they have a young baby. And so all these factors need to be taken into consideration because they actually could precipitate a perinatal mental illness. Furthermore, we have to also be very open about the fact that there is an incredible societal pressure on young mothers to outperform. The standards are very high. Women are expected to run the household, look after the children, outperform at work, often without very little support. And so for many women, motherhood it's a joyful experience and it's quiet and everything goes smoothly. But for many other women, this type of experience is extremely challenging and can actually be quite isolating. And women, as I mentioned before, they tend to suffer in silence to the point that then the illness progresses to the point where it's very difficult to treat and manage it.